If you are over 60 and you wake up with your mouth so dry it feels like cotton, please listen carefully, because the glass of water beside your bed may not be fixing the real problem. You wake up, your tongue feels sticky, your lips feel cracked, your throat feels scratchy, so you take a sip of water and tell yourself, maybe I was just thirsty. But here's what most people miss. Dry mouth at night is not always about thirst. Sometimes it is a medicine clue. Sometimes it is a breathing clue. Sometimes it is a blood sugar clue. Sometimes it is a sleep clue. And sometimes it is your mouth warning you that it is losing the protection it needs. Don't panic. But don't ignore the pattern, because the danger is not waking up with a dry mouth one time. The danger is waking up dry every morning, month after month, and assuming it is only thirst. Stay with me, because in this video, I'm going to show you the 7 hidden causes of dry mouth at night after 60, the warning signs you should not ignore, and a simple 3-night checklist that can help you know what to ask your doctor, dentist, or pharmacist. And one of these causes has almost nothing to do with your mouth, but it can leave your mouth dry every single morning. Margaret was 68. Every morning, she woke up with her tongue stuck to the roof of her mouth. Her lips were cracked. Her breath felt sour, her throat felt rough, and before her feet touched the floor, she reached for the same glass of water on her nightstand. At first, she blamed the weather. Then, she blamed the heater. Then, she blamed age. Then she blamed herself. She said, "Maybe I just don't drink enough water." So she started drinking more before bed. But then she woke up 2 or 3 times to use the bathroom. Her sleep got worse. She felt tired during the day, and the dry mouth still did not go away. That is where the danger begins. Because sometimes drinking more water at bedtime only covers the symptom. It does not answer the real question. Why is your mouth drying out while you sleep? Hello, I'm Dr. Michael Carter. On this channel, we explain senior health in plain English, without panic, without shame, and without making you feel foolish for asking simple questions. Today we are talking about dry mouth at night after 60. This video is educational and does not replace your own doctor, dentist, pharmacist, or medical team, but it can help you stop guessing and start asking better questions. And before we go deeper, remember these 3 patterns. Dry mouth plus a new medicine may point toward a medication side effect. Dry mouth plus loud snoring, choking, or gasping may point toward a breathing problem during sleep. Dry mouth plus strong thirst and frequent urination may point toward blood sugar. Those 3 patterns are important, because the real question is not only, am I thirsty? The real question is, what pattern is my body showing me? Now let's start with the simple truth. Your mouth needs saliva. Saliva is not just spit. Saliva helps you chew. It helps you swallow. It helps food taste normal. It helps wash food particles away. It helps protect your teeth and gums. It helps control germs in the mouth. So when saliva becomes too low, the mouth can feel sticky, sore, dry, rough, or irritated. You may notice bad breath. You may notice a burning feeling. You may have trouble swallowing dry foods like crackers, bread, or rice. You may wake up needing water. You may notice cracked lips. Your dentures may start rubbing. Your tongue may look red, dry, rough, or cracked. And here's the part many seniors do not realize. Dry mouth is not just uncomfortable. It can become a dental problem. When the mouth stays dry, the teeth and gums lose some of their natural protection. That can increase the risk of cavities, gum problems, mouth sores, and infections. So, if your mouth is dry once in a while, do not panic. But if it keeps happening, your body may be asking for help. Now let's go through the 7 hidden causes, because number 1 is one of the biggest causes seniors miss: medicines. Many people never connect dry mouth with medication. A person starts a new blood pressure medicine, or a bladder medicine, or an allergy pill, or a sleep aid, or an anxiety medicine, or a depression medicine, or a pain medicine, or a cold medicine. Then a few weeks later, they start waking up with a sticky mouth every morning. But they do not blame the medicine. They blame age. They blame the room. They blame not drinking enough water. They blame themselves. Please hear this clearly. Many prescription and over-the-counter medicines can make the mouth feel dry. That does not mean the medicine is bad. It does not mean you should stop it. Never stop your medicine on your own after watching a video. Some medicines protect your heart, your blood pressure, your breathing, your mood, your bladder, or your sleep. Some medicines must be reduced slowly. The safe step is not stopping. The safe step is reviewing. Ask your doctor or pharmacist this simple question. Could any of my medicines be causing dry mouth at night? Then ask the second question, because this one matters even more. Could the combination of my medicines be making it worse? Because sometimes the problem is not one pill, it is the stack. One medicine dries the mouth, another makes you sleepy, another makes you urinate more, another affects breathing, another causes thirst, and suddenly your whole night is broken. Before your next appointment, write down everything you take, not just prescriptions, allergy pills, sleep aids, cold medicines, pain relievers, bladder pills, inhalers, vitamins, supplements, mouth rinses, anything you use regularly. The mistake is not taking medicine. The mistake is never reviewing it, because number 2 is mouth breathing. This sounds simple, but it is extremely important. If you sleep with your mouth open, air passes over your tongue, gums, and throat for hours. By morning, your mouth may feel dry, sticky, and irritated. You may think, I need more water. But the real issue may be that you are breathing through your mouth all night. Why does that happen? Your nose may be blocked. Allergies, sinus problems, dry nasal passages, a deviated septum, congestion, dry air, a fan blowing toward your face, or sleeping flat on your back. Sometimes people mouth breathe because they snore, and sometimes snoring is not just snoring. That brings us to cause number 3, sleep apnea. Now listen carefully. Not every person with dry mouth has sleep apnea, and not every person who snores has sleep apnea, so do not jump to fear. But if dry mouth comes with loud snoring, choking, gasping, morning headaches, daytime sleepiness, high blood pressure, or waking up tired even after enough hours in bed, you should speak with your doctor. Because the problem may not be your mouth, it may be your breathing. Sleep apnea means breathing repeatedly stops or becomes shallow during sleep. Many people do not know it is happening because they are asleep when it happens. A spouse, partner, child, or caregiver may notice it first, so ask someone close to you, do I snore loudly? Do I stop breathing? Do I gasp? Do I sleep with my mouth open? Do I wake up choking? That information can help your doctor. Here is a simple clue. If you wake up with dry mouth and you also wake up exhausted, pay attention. If you wake up with dry mouth and morning headaches, pay attention. If you wake up with dry mouth and someone says you gasp in your sleep, pay attention. That does not mean panic. It means check. Because after 60, poor sleep is not just a nighttime problem. It can affect energy, balance, memory, mood, blood pressure, and safety during the day. Because number 4 is blood sugar. This is one of the most important hidden causes. Dry mouth can be linked with diabetes or high blood sugar. That does not mean dry mouth automatically means diabetes. Please do not diagnose yourself from one symptom, but if dry mouth comes with unusual thirst, frequent urination, blurry vision, fatigue, slow healing, repeated infections, or unexplained weight loss, ask your doctor whether your blood sugar should be checked. Here is the pattern many seniors miss. They feel dry, they drink more water, then they urinate more, then they wake up more at night, then they feel tired. They think the whole problem is thirst, but the body may be giving a bigger signal. So remember this simple triangle: dry mouth, strong thirst, frequent urination. If those 3 are happening together, especially if they are new or getting worse, do not ignore it. Ask for a simple check. You are not being dramatic. You are being careful. Because number 5 is dehydration and evening habits. Yes, dehydration can make your mouth dry, but the solution is not always to drink a lot of water right before bed. For many seniors, that creates a second problem. More bathroom trips, more broken sleep, more fatigue the next day. A better question is, how am I hydrating during the whole day? Do you drink very little in the morning? Do you avoid fluids because you fear nighttime urination? Do you drink mostly coffee or tea? Do you drink alcohol in the evening? Do you eat salty snacks at night? Do you sweat a lot? Have you had diarrhea, fever, vomiting, or illness? Are you taking a medicine that makes you urinate more? Hydration is not just about bedtime. It is about the full day. For many people, sipping water earlier, drinking with meals, and reducing alcohol or caffeine late in the day may help. But here is an important warning. If your doctor told you to restrict fluids because of heart failure, kidney disease, liver disease, or another medical condition, do not change your fluid intake on your own. Ask your clinician what is safe for you, because number 6 is dry air and blocked nose. This is common, especially when heating, air conditioning, or a fan runs at night. Dry air can irritate the mouth and throat. A fan blowing toward your face can make it worse. A room that is too dry can make you wake up scratchy and uncomfortable. A clean humidifier may help some people, but the word clean matters. A dirty humidifier can grow mold or bacteria and make breathing problems worse. So if you use one, clean it properly. But also look at your nose, because if your nose is blocked, your mouth becomes the backup breathing route. And if your mouth becomes the backup breathing route every night, it dries out. So the solution may not only be adding moisture to the room, the solution may be asking why your nose is blocked. Allergies, sinus problems, nasal dryness, congestion, sleep position. These are worth discussing if the problem keeps happening. Cause number 7 is saliva gland problems, including Sjogren's disease. This is not the most common cause, but it is one doctors and dentists may consider when dry mouth comes with dry eyes. Sjogren's is an autoimmune condition that can affect moisture-producing glands. Some people may have dry mouth and dry eyes. Some may also have fatigue, joint pain, burning mouth, trouble swallowing dry foods, or frequent dental problems. Here is the clue. If you have dry mouth plus dry eyes, do not ignore that combination. If you constantly need water to swallow food, pay attention. If your dentist keeps finding new cavities even though you brush, ask questions. If your mouth burns or feels sore often, mention it. This does not mean you have Sjogren's. It means your dry mouth deserves evaluation. Dry mouth is a clue, and a clue should be investigated, not guessed away. Now let's pause, because I want to give you a simple 3-night dry mouth checklist. This is one of the most useful things you can do before calling your doctor, dentist, or pharmacist. For the next 3 nights, write down 5 things. Number 1. Did I wake up with dry mouth? Was it mild, moderate, or severe? Number 2. Did I wake up to urinate? How many times? Number 3. Did anyone notice snoring, mouth breathing, choking, or gasping? Number 4. What did I drink in the evening? Coffee, tea, alcohol, soda, water? Number 5. Did I recently start or change any medicine, sleep aid, allergy pill, cold medicine, bladder medicine, or pain medicine? This little diary can be powerful because when you go to the doctor, dentist, or pharmacist, you are not just saying, "My mouth is dry." You are saying, "My mouth is dry every morning. It started after this medicine. I wake up 3 times to urinate. My daughter says I snore. I drink tea every night. My nose is blocked. My dentures are hurting." That is useful information. That helps your medical team find the real pattern. Now, let's talk about the warning signs you should not ignore. Call your doctor or dentist if dry mouth does not go away, if it keeps waking you up, if you have trouble chewing or swallowing, if your mouth burns, if your tongue looks cracked, red, or very dry, if you have mouth sores, if you keep getting cavities, if dentures suddenly feel painful, if you have dry eyes with dry mouth, if you are constantly thirsty, if you urinate much more than usual, if you wake up choking or gasping, if you have loud snoring and daytime sleepiness, if you have unexplained weight loss, and if you have fever, weakness, confusion, or signs of dehydration, seek medical care quickly. These signs do not point to one single diagnosis. They simply mean your body needs attention. Now let's talk about safe steps that may help while you are looking for the cause. Sip water during the day instead of only drinking a lot at bedtime. Drink water with meals to help chewing and swallowing. Avoid alcohol before bed. Avoid tobacco. Limit caffeine later in the day. Avoid very salty or spicy foods at night if they irritate your mouth. Try sugar-free gum or sugar-free lozenges if they are safe for you. Choose alcohol-free mouthwash. Brush and floss carefully. See your dentist regularly. Ask your dentist about fluoride, dry mouth products, saliva substitutes, or special toothpaste. Use a clean humidifier if the air is dry. Keep fans or air conditioners from blowing directly at your face. Pay attention to snoring and mouth breathing. Review medicines with your doctor or pharmacist. And if you wear dentures, do not ignore new rubbing, pain, or sores. Now here is what not to do. Do not stop medicine on your own. Do not keep taking nighttime cold medicine, allergy medicine, or sleep aids without asking a professional. Do not use sugary candy all day to create saliva. Do not ignore mouth sores. Do not assume it is just age. Do not assume it is only dehydration. And do not feel embarrassed. Dry mouth is common after 60, but common does not mean harmless when it keeps happening. Common does not mean you should suffer quietly. Here are the exact questions to ask. Ask your doctor or pharmacist. Could any of my medicines be causing dry mouth? Could the combination be making it worse? Can any medicine be adjusted safely? Can any medicine be taken earlier in the day? Are there safer alternatives? Ask your doctor. Could this be related to blood sugar? Could snoring or sleep apnea be part of this? Could my blocked nose be causing mouth breathing? Could dry eyes and dry mouth suggest a saliva gland or autoimmune problem? Ask your dentist. Is my dry mouth affecting my teeth or gums? Do I need fluoride protection? Should I use saliva substitutes or dry mouth rinse? Are my dentures causing sores because my mouth is too dry? These questions move you from guessing to checking, and after 60, guessing is not a health plan. Now I want to speak directly to the senior watching quietly. Maybe you keep water beside your bed every night. Maybe your mouth has felt sticky for months. Maybe your lips crack. Maybe your food does not taste the same. Maybe your breath embarrasses you. Maybe your dentures hurt. Maybe you think, this is too small to mention. Please hear me. You are not being dramatic. You are not being difficult. You are not wasting anyone's time. Your mouth matters. Your sleep matters. Your teeth matter. Your comfort matters. And your body's signals matter. A dry mouth may be small, but the pattern behind it may not be. At the beginning, I told you about Margaret. She thought her dry mouth was just thirst. But when she wrote down her symptoms, the pattern became clear. Her dry mouth started after a new medicine. She was drinking tea late in the evening. Her nose was blocked at night. Her daughter noticed loud snoring, and her dentist found early signs that her mouth was staying too dry. Margaret did not need panic. She needed a plan. Her doctor reviewed her medicines. Her dentist helped protect her teeth. She changed her evening routine. She paid attention to her breathing. And slowly, her mornings became easier. Not perfect, not overnight, but better. That is the message. Dry mouth at night after 60 is not always dangerous. But when it keeps happening, it should not be ignored. Maybe it is medicine. Maybe it is mouth breathing. Maybe it is sleep apnea. Maybe it is blood sugar. Maybe it is dehydration. Maybe it is dry air. Maybe it is a saliva gland problem. The safest thing you can do is notice the pattern, write it down, and ask the right questions. If this video helped you understand dry mouth in a calmer way, subscribe to the channel. Here, we explain senior health in plain English, serious, practical, and protective. And if you know someone over 60 who wakes up with dry mouth every morning, share this video with them. It may help them stop guessing and start checking. Remember, don't panic, don't ignore it, and don't assume it is only thirst. Your body is not betraying you, it is asking for help. I'm Dr. Michael Carter, and I'll see you in the next video.